Understanding Alzheimer's, a journey of memory. Alzheimer's disease is a brain disorder. It slowly destroys memory and thinking skills. This makes it hard to do everyday tasks. Imagine a library where books are slowly disappearing. That's what happens to the brain with Alzheimer's. It's the most common cause of dementia. Dementia is a general term for memory loss and other cognitive abilities. This disease doesn't just affect the person with it, it affects families and friends too. They become caregivers, often facing difficult emotions. It's important to remember that you're not alone in this journey. Scientists are working hard to understand Alzheimer's. There is still no cure, however, there are treatments to help manage symptoms. There is also a lot of support available for patients and their families. Remember, knowledge is power. Understanding Alzheimer's is the first step to coping with it. We can all work together to support those living with this disease. Recognizing the signs, symptoms, and progression. Alzheimer's doesn't happen overnight, it progresses slowly in stages. Early signs can be subtle, like forgetting recent conversations or misplacing things. As the disease progresses, the symptoms become more noticeable. Difficulty with familiar tasks is another sign. For example, someone might forget how to cook a simple meal. Changes in personality and mood are also common. Confusion, anxiety, and depression can occur. In the later stages, individuals might have trouble recognizing loved ones. They might need help with basic activities like eating and bathing. This can be a very challenging time for both the person with Alzheimer's and their caregivers. It's important to remember that every individual experiences Alzheimer's differently. The progression of the disease can vary. Early diagnosis is crucial. It allows for timely intervention and support. The caregiver's burden navigating emotional and physical challenges. Caring for someone with Alzheimer's is a demanding task. It's physically and emotionally draining. Caregivers often experience a range of emotions, including sadness, frustration, and even anger. It's important for caregivers to acknowledge these feelings and seek support. The physical demands of caregiving can also be significant. Helping with bathing, dressing, and toileting can be physically tiring. Caregivers might also experience sleep disturbances due to nighttime care needs. It's easy for caregivers to neglect their own well-being. However, self-care is crucial. Remember, you can't pour from an empty cup. Taking breaks, engaging in hobbies, and seeking support groups can help caregivers cope. Finding strength in support. Resources and strategies for coping. There are many resources available for those affected by Alzheimer's. Support groups offer a safe space to share experiences and coping strategies. The Alzheimer's Association is a great resource for information, support, and local services. Maintaining a routine can be helpful for someone with Alzheimer's. It provides a sense of security and familiarity. Engaging in activities they enjoy, such as listening to music or looking at old photos, can also bring comfort and joy. Communication can become challenging as the disease progresses. Use simple sentences and speak slowly and clearly. Be patient, as it might take time for the person to process information. Remember, you're not alone in this journey. With support, understanding, and compassion, we can navigate the challenges of Alzheimer's together.